morning, everyone. I hope everyone is doing good, right? So today I came with one another neonatal disorder condition, that is the neonatal respiratory problems. Yes, today we'll be talking about some of the respiratory conditions seen in neonates. Okay, let's talk about the respiratory distress syndrome, which you might have known very commonly, right? It is seen very common in the children who are premature, who are born prematurely. Before taking you to the main condition, let me tell you what is this distress, the respiratory distress which I was talking about. Respiratory distress in the newborns, it is recognized as one or more signs of increased work of the breathing, such as, for example, the tachypnea, which is seen in the children, the nasal flaring, you can see the chest retractions, as well as the child is having grunting, or you can say the urge to have the oxygen. Now, let me talk about the respiratory distress syndrome. While introducing this condition, this distress syndrome of newborn, it was previously called as the hyaline membrane disease. Before given the new name, it was namely as hyaline membrane disease, which is a syndrome in premature infants, which is caused by the developmental insufficiency of the surfactant production, as well as the structural immaturity of the lungs. As the premature, the infants, they'll be having the lungs not developed. That means the lungs are still not developed, they are immature, and the child is not able to have the normal access to the oxygen. As this respiratory distress syndrome, it is the leading cause of death in case of the premature infants. It occurs in 50% babies who are born at 26 to 28 weeks of the gestation, as well as 25% of the babies who are born at 30 to 31 weeks of the gestation. If we talk about the causes of this respiratory distress syndrome, this respiratory distress syndrome is caused by the baby who are not having enough surfactant in the lungs. The surfactant, it is actually a liquid which is made in the lungs at about 26 weeks of the gestation when the fetus is in the mother's womb. As the fetus grows, the lungs make more surfactant, and this will coat the tiny air sacs, that is the alveoli, which help to keep them from the collapsing. So it helps in between the alveoli, the tiny air sacs, to collapse with one another. So this kind of liquid is called as the surfactant. Apart from the lung maturity, the production of the surfactant, it may be comprised by the damage of type 2 alveolar cells due to the birth asphyxia or due to the acidosis and shock that may lead to the damage to these alveolar cells. In case of the maternal diabetes, it may also delay the maturation of the lungs of the infants, and which may have an impact over the birth of the child. Let's talk about some of the clinical features in this respiratory distress syndrome infants. The manifestations which are usually caused of this disease by the diffuse alveolar atelectasis, or you can say the edema and cell injury. These manifestations will begin shortly after the delivery of the infant. The child will be seen with tachypnea, presence of tachycardia. There will be the chest wall retractions, expiratory grunting, nasal flaring, and cyanosis will be seen as it's the most common manifestations. As the disease is progressing, the baby may develop the ventilatory failure, as the carbon dioxide concentration will be increased in the blood and a prolonged cessation of the breathing may occur. Let's see how to diagnose, or what can be the diagnostic evaluations for this condition. First of all, we have to talk about the prenatal diagnosis, as the respiratory syndrome can be made by determining the lecithin, or we can say the sphygmomyelin ratio in amniotic fluid. These are the surfactants. These both are surfactants, that means they are the chemicals which are made by the lungs to help them work correctly. So this ratio can be identified, and that may help us to find out the condition. If this lecithin sphygmomyelin ratio is more than 2, it may indicate that there is adequate lung maturity. The next thing under this diagnostic evaluation comes the perinatal risk factors. So the factors which are affecting the lung development at the time of birth. That may be the prematurity, as I mentioned already. There can be the immaturity of the lungs, and the lungs are not completely developed. Maternal diabetes, as it's one of the causes. Genetic factors can also be an indication. For example, the white race history of the respiratory distress syndrome in the siblings. If there is presence of the thoracic malformation, that will cause the lung hypoplasia, such as the diaphragmatic hernia, which may have the distress over the lungs. The factors which are acutely impairing the surfactant functions are perinatal asphyxia in case of the premature infants. Yes, this will lead to the distress syndrome. If the cesarean section is done before the labor gets started, then the surfactant level is very impaired. Now we'll talk about some of the postnatal diagnosis. A premature infant will be having the manifestations shortly after the birth. For example, the tachypnea. There will be the retractions of nasal flarings and the sinus, so the basic and the common manifestations which are seen on infants. The chest x-ray that will show the areas of the atelectasis and the presence of the filled bronchi with the help of air bronchogram. The next diagnostic part is the atrial blood gas analysis, which is done to show the partial carbon dioxide concentration above 65 of Hg, as the normal is 45, and the partial, that's arterial partial oxygen, that is above 40 of Hg, as the normal is 50 of Hg. If we talk about the management of respiratory distress syndrome, as this respiratory distress syndrome is the most common life-threatening emergency in premature infants. So some of the principles of management of respiratory distress syndrome may include: ventilation is to be improved to enhance the oxygenation, as there is a lack of oxygen to the infants. Acidosis is to be corrected. Thermoneutral environment is to be maintained. And the talk about nutrition, so adequate nutrition is very necessary. So the management can be for the baby with respiratory distress syndrome. First of all, the baby's general condition is to be monitored, and that some of the clinical observations are to be done while you are monitoring the baby. Rectal or the skin temperature should be noted early till the stability is seen in the child. Hourly respiratory rate is to be checked to check for the improvement or the deterioration. Severity of the retractions as well as the grunting is seen, whether it is improved, whether it is increased or it is decreased. The baby's activity, the responsiveness of the baby, as well as the pitch of the cry is to be noted again. Definitely the urine output is to be seen. Then the next thing comes the intravenous infusion for the baby to maintain the S-base balance as well as the nutritional status. Because the oral feeding will not be possible for the baby, as there is a chance of aspiration. So the infants need to be given the nasogastric feeding, or if possible then total parental nutrition is to be given to provide the tissue catabolism. Next thing comes under the management is the ventilatory. As the infants with this condition, that is the hyaline membrane disease, or you can tell the respiratory distress syndrome, they are handicapped by decreased lung compliance as well as the alveolar collapse during the expiration. So they definitely need the ventilators for their support. Administration of the oxygen under the positive pressure would prevent the alveolar collapse and ensure the gas exchange throughout the respiratory cycle. Continuous positive air pressure is indicated and useful in infants who are having the decreased lung compliance. The fourth thing comes under this management is the oxygen via the food. So, after weaning the baby from the ventilators, oxygen should be administered in the form of the wool, or you can say, it's a type of oxygenation procedure where the child is kept under the hood for the oxygenation purpose, and it is done to maintain the partial oxygenation between 50 to 80 of Hg, or a saturation of above 90 to 95%. Then comes the next thing, that is the warmth as well as the humidity. The baby's skin temperature should be maintained at around 36.5 degrees Celsius, either by keeping the baby in the incubator or the warmer, or you can keep the baby near to the mothers, or if possible in the thermoneutral environment. Then the next thing comes, that is the surfactant therapy. Several clinical trials that have provided the effectiveness of the surfactant therapy in both prevention as well as in the management of respiratory distress. The surfactant therapy, it improves the chances of neonate survival by improving the lung compliance as well as the oxygenation of the infants. Surfactant therapy, it is administered through the intratracheally, that is through the ET tube, in a dose of 100 mg per kg body weight. The surfactant therapy may have some of the side effects, that is like the apnea, hypotension, pulmonary hemorrhage, or there can be the chances of bradycardia. Then the next thing comes, that is the antibiotics, which are necessary to maintain the level of infection to prevent the child from getting any kind of sepsis. Septic screening as well as the periodic cultures from the ET tube and the blood, they are taken to guide the antimicrobial. Now we'll talk about the nursing management, which is also very necessary to maintain throughout the procedures, throughout the period of this disease. First of all, these infants with this respiratory distress syndrome, as they are very much prone to infections, as well as due to the procedures, they will be getting the intermittent infections as well. So it is very necessary to prevent the children from any kind of infections by using the isolation as well as the aseptic techniques. The infants who are critically ill, they should be handled minimally. These infants are to be positioned in an elevated position to reduce the pressure over the diaphragm. The airway of the infants are to be kept potent by extending the head slightly. The baby has to be kept warm to maintain the thermoregulation by keeping the baby in the incubator or in the radiant warmer. While suctioning the baby, the normal oxygen level as well as the vital signs are to be maintained continuously. By using the strict aseptic techniques, when it's required to go for the endotracheal suctioning, intravenous fluids are to be administered and maintained continuously, as well as the nasogastric fed and medications that are prescribed by the physicians. There can be some of the complications of the respiratory distress syndrome. If the respiratory distress syndrome is not treated well, if the respiratory syndrome is not getting improved, so there can be the chances of the pneumothorax, possibility of patent ductus atrocis, chronic lung disease may occur, retinopathy of the prematurity. Next, very respiratory condition among the infants, which is very common, is the meconium aspiration syndrome. Let me introduce you to the meconium, which is aspirated by the infant. Meconium, it is the early stool passed by a newborn soon after the birth, before the baby starts to feed and digest the milk or any kind of formula. This meconium, it is composed of the epithelial cells, it is the fetal hair, as well as the mucus and amniotic fluid. So the neonates who are born to the mothers with the thick or the thin meconium stained liquor, that can be aspirated into the lungs, and they develop the respiratory distress. Let's see the definition of the meconium aspiration syndrome. Meconium aspiration syndrome is actually a trouble breathing, that is the respiratory distress in a newborn who has breathed or who has aspirated a dark green sterile fecal material that I called meconium that I mentioned before, right? So this meconium will be aspirated into the lungs before or around the time of birth. What causes the infants to aspirate this meconium into the lungs? Meconium aspiration syndrome may be caused, or this may occur when the baby experiences stress which is often resulted when the amount of oxygen available to the fetus is reduced or deducted. Some causes can be, which are related to the fetal stress. They can be a pregnancy that goes beyond the accurate date, that means the date that is more than 40 weeks of the gestation. If there is difficult or the prolonged labor, certain health issues which are experienced by the mother during the pregnancy, for example the hypertension, the diabetes, or if the mother is mother has undergone any kind of infectious disease during the time of pregnancy. There are certain clinical features of the meconium aspiration syndrome which can be as the respiratory distress. This is the most prominent symptom under this condition. Rapid breathing or grunting can be seen while the infant is breathing. The baby is seen with the barrel-shaped chest by overinflation. Cyanosis, that is the bluish discoloration, it can be over the whole body, it can be over the extremities, around the lips. The limpness will be seen. The child will be, in a shape as if the child is dead. The blood pressure of the infant will be low. Let's talk about the management. All the babies who are born to the mothers with the thick or the thin stained liquor should have oropharyngeal suctioning before the delivery and immediately after the delivery. Endotracheal intubation and suction needs to be done for removal of this meconium. High oxygenation concentration at high ventilatory rate is to be provided using mechanical ventilation. Antibiotics are to be given to prevent from any kind of infections. So we have talked about the respiratory problems which are seen in the infants very commonly, that is especially the respiratory distress syndrome as well as the meconium aspiration syndrome. I hope you got the idea regarding these conditions, as these are very commonly seen in case of the premature infants, and this is the these are the conditions which are the main leading cause for the deaths in infants within the first some of the weeks of the life of the infant. And these respiratory distress syndrome are to be treated according to the causes, according to the factors which are responsible for the respiratory problems, as well as the management, that is the nursing management and the preventive measures are to be taken prenatally and in case of the intranatal as well as in the postnatal periods. I hope you have understood the condition and will be much helpful to your studies. I'll see you in the next session. Till then, take care and have a good day.